Hello guys, if you're somebody who is thinking that to crack NEET SS anesthesia exam you have to read for 5 to 6 to 7 hours, you're actually wrong. See, you can clear this NEET anesthesia exam with a very decent rank if you have a very minimalistic approach. Hello, I am Dr. Sai Kishore and I have cleared this NEET SS exam in the year of 2024 with an all India rank of 1. So let me tell you what strategy I used. Before going to the strategy, we have to understand there are two kinds of people who are preparing for this NEET SS exam. First category is going to be the people who have just completed their residency. Now these people, they have touch with their books, they have touch with the clinical practice also. So for them I would slightly recommend a different approach. Start with your MCQs. Always do only MCQs. You don't have to go back to the concepts, because I think most of you will be already in touch with the concepts. If you have a particular doubt, you can always go back and read in the book. Now for the second category of people, these are the people who have been working for quite a few time after your residency, and now they are planning to prepare for their super specialty exam. Now for these people, yes, it is better to go through the textbook, and it is better to join some of the coaching apps which will revise your concepts. See, now I don't endorse any of these apps, but some of the very popular apps are Speed, Marrow and Raw Online. Personally, I have used this Raw Online and it's quite a good app, and I have been using it from second year of my residency. Now what are these MCQ books that you should solve? There are two main books. Okay, first is Brain and Hall, second is Lippincott. Now each of these textbooks have almost 1000 MCQs. Together they form almost 2002 MCQs. Now there might be repetitions among that, but these two books are the most extremely important books that you have to read. If you do 50 MCQs per day, you can finish this textbook in 1 to 1.5 months, and you have to revise this textbook at least twice before going for your exam. This is going to be your main preparation, and if you prepare this, trust me, almost 80 to 85% of the questions are going to come from this. For some questions which are coming from pain medicine, you can go through some books like Pain Medicine by Dr. Chinmoy, but I just feel that it is overkill to do an entire textbook of MCQs just for 5 to 6 questions. Most of the questions from pain, you will already know the answer. You just have to think it properly before answering. Now, another important part of preparing for NEET exam is to go through the images. Please go through all the images in Miller's textbook. Now, most of the pictures in the NEET exam are going to be from the Miller's Anesthesia, and please go through the tabular columns which are present in Miller's Anesthesia, because any discrepancy in any questions, the answer will be based only on the Miller's textbook of anesthesia. If you have any more doubts about NEET SS anesthesia, please comment below and I will answer to all of those questions. Thank you. Subscribe for more.